Becoming a parent for the first time is a feeling that's not easily forgotten.
So when we found out we were pregnant, it was a bit of a surprise. We were a little bit nervous.
Mostly excited about it, about the idea and seeing what it'd be like to be parents.
The first moments with Camden were priceless. He was quiet, not a fusser.
As a parent, you want to protect your baby from the hardships of the world, especially the hardships of health complications.
About a week after Camden was born, received a phone call that his newborn screening test was abnormal and they needed us to come back and be rechecked.
A newborn screening is a simple blood test for genetic disorders performed soon after the baby is born.
So we took him in, had another blood test done, and then it was a few days after that they called us with the diagnosis of PKU.
PKU is a disorder where the body cannot process protein, and if left untreated, can cause intellectual and developmental disabilities.
It was quite terrifying, actually. They didn't have a lot of experience with it in our medical facility here.
Yeah, Samantha was a very normal baby in many ways, did the normal baby things, and looking at her, you wouldn't have known that her immune system wasn't functioning properly.
Sarah and Jeremy soon found out that Samantha had severe combined immunodeficiency, or SCID, a disorder that, at the time, was not part of her state's panel of conditions screened for in newborns. Sadly, Samantha's SCID was detected too late, and she passed away before her second birthday.
We're people of faith, and so we believe that even though our story was a sad one and a tragic one, it was kind of a godsend that SCID screening became so, for lack of a better word, popular not long after she died.
The screening is so crucial because had we not had that, now we would have a severely mentally delayed child, and now he's leading a normal life.
Because of an early diagnosis, a special change in his diet prevented developmental disabilities from forming in Camden.
It was a relief to understand that he was going to live a normal life and we weren't going to have to deal with all of the horrible things that we read about.
You think our families are healthy, we don't have any history of diseases, why would we need newborn screening? But what you don't realize is that many of these conditions, you can't identify them just by looking at a child, and that many of them show up in children whose families have no history of the disease.
If an abnormality is found in your baby's screening, your healthcare provider can help you take the next steps, such as additional testing and treatments. When found within the first few days of birth, many of these disorders can be treated, and babies can grow up to be healthy with normal development.
The screening that we had done that showed the PKU definitely changed our lives and saved our little boy's life.
It's nothing. It's a simple blood test. It's a heel prick. That's all it is.
Saves money, saves heartache, saves time, but I mean, most importantly of all, it saves lives.